Come in. Oh,
Okay. Hi there. I'm Anastasia. I'm gonna wash my hands here.
okay.
I'm your midwife today. Do you mind just telling me your name and date of birth?
Lucy Greeley, April 27th, 2001.
Okay, great. Well, nice to meet you, Lucy.
Me too.
So today what I'm doing is I'm gonna be doing a full neurological test on you, full workup.
Okay.
And I'm gonna be doing lots of touching and moving you around. So if there's anything you don't feel comfortable with or you can't do physically, please just tell me, okay?
Okay.
All right. And my hands are a bit cold, by the way.
Okay.
We're gonna start out by testing your optic nerve, which is cranial nerve 2. So we're gonna do that by testing initially your visual acuity. So do you mind stepping back? We're gonna do 10 feet here. And I'd like you to read the smallest, go ahead and cover one of your eyes and do go ahead and read the smallest line you can here.
Okay. LEFODPEC.
Okay. Now go ahead and cover the other eye, please. All right, and once again, read the smallest line you can. It's okay if it's the same one. It's okay if it's not too.
LEFOPTC. Also, I just realized I read a different line last time. Whatever.
No, you didn't. Okay,
Oh,
great. You had 20 out of 20. Great.
Okay.
So perfect. Go ahead and sit down here. And what I'm going to go ahead and do here is test your pupil reaction to light and accommodation, which is testing your, once again, your optic nerve, which is cranial nerve 2.
Okay.
Okay, so I'm going to be shining this light in your eyes. It's going to be quite bright.
Okay.
Alright, but it's just to see if your pupil contracts or not. So just look at me. The light's going to come through. Great. The other one. Okay, wonderful. And now this time what I'm going to do is just go ahead and look at the tip of this. I'm going to bring it close to your eyes and check again for your pupil
Okay.
accommodation. Okay, great. So you do have pupils equal, round, reactive to light, and accommodation. Wonderful. So then what I'm going to be doing is I will go ahead and I'm going to be testing your visual field, which is once again optic nerve.
Okay.
So with this one, what I'll be doing is I'm going to be taking my fingers and wiggling them around in this shape, and when you can see one, please tell me.
Okay.
And go ahead and just keep your eyes on my eyes while we're doing
Okay.
this.
Now. 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 Now.
Okay, great. So it's equal on all sides. Now what I'm going to be testing is your cranial nerve 3, your cranial nerve 4, and your cranial nerve 6 to see how your eyes work in terms of their different movements, okay?
Okay.
So what I'm going to be having you do again is watch this, and actually that is what I was testing previously when I was testing your accommodation.
Okay.
But I'm going to have you follow the tip of this again, and I'm going to draw it in a line, a couple of different shapes, okay? And just keep your eyes right on the top of this.
Okay.
Keep looking at the top of it if you can. Okay, so cranial nerves 3, 4, and 6 are all intact. Now what I'm going to be doing is, if I did have an ophthalmoscope, I would use this time to check your red reflex. And what I do is I'd stand 12 to 18 inches away from you. I'd have my ophthalmoscope. I'd shine it in your eyes and try to see if the reflection is bilaterally equal, showing me that your eyes are, that you don't have any strabismus, and that also showing me that you don't have any tumors or anything like that.
Okay.
So that's what I'd be assessing this time, but I can't do that. So then I'd also go ahead and take my ophthalmoscope and I'd come in here and get very close. And what I would do is I would, let's see, a tool shaped like this, and I'd come in here and I would look in the back of your eye and check your optic nerve. I'd check to see your artery to vein ratio. I would check to see the optic disc is well defined. I'd check to see your macula and just make sure it all looks good. And I would do it also once again on this side with the same technique here. I'm getting very close to your eye, okay? But I can't do that. So now what we're going to be doing is we're going to be testing your auditory nerve, which is cranial nerve 8.
Okay.
And we're going to be doing this with a variety of different tests. Okay, so I'm going to come around behind you. All right, Lucy. And we're going to start. Is it okay if I move your hair?
Yeah.
Okay. I'm going to start by. What we'll do is you'll have you close your eyes, and I'm going to be going ahead and rubbing my fingers, and I want you to tell me when you can hear something, and then in which ear you can hear it in. Okay.
Okay. Now. 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 Now.
Okay. And now I'm going to be doing a watch tick test. So you're going to be listening for the ticking of my watch, but actually my watch doesn't tick very well, so this is what I would do. I would just go ahead and do a very similar thing, bring my watch up to Lucy's ear and have her tell me when she can hear the watch ticking, but we've tried this earlier and it didn't work. So now I'm going to be doing the whisper test, and with this one, I'm going to go ahead and put my fingers on your ear, okay? And be rubbing a little bit here, and I'm going to be whispering 3 words, and I want you to tell them to me what they are, okay?
Okay. Artwork, painting, mosaic.
Okay, great. Now we're going to do the other side here.
Orchid, box, drum.
Okay, excellent. And now what we're going to be doing is I'll be using my tuning fork now, and for doing this I would have a real tuning fork, but when I do the Weber test, and I would go ahead and hit this, place it in the middle of Lucy's skull here, and I would ask her to tell me if she hears it more on one side versus the other, which would indicate that one ear is stronger than the other. I would also go ahead and do the runny test, and for that I'd also once again hit this, go ahead and place it on her mastoid bone, and as soon as Lucy tells me she can no longer hear it, I will quickly move it up to her ear and see if her bone conduction versus her air conduction is better. And go ahead and do it again on this side. And you do want to see that the air conduction is better than the bone conduction. Otherwise there may be some structural issues with the middle ear. Okay, so now Lucy, what I'm going to be doing is testing your cranial nerve 5, which is your trigeminal nerve. And for this one, I'm going to test the motor part of this first. Can you clench your jaw for me? Okay, here I'm assessing the masseter muscle and also the temporal muscle. Okay, excellent. It appears to be intact. Next, what I'm going to be doing is testing your testing your ability to distinguish between soft and sharp touch on your face, which is the sensory part of the trigeminal nerve. Okay, so this is what the soft feels like. And this, I would not normally use a thumbtack. I would use something disposable, but that's what we're using today. And this is the thumbtack. So go ahead and close your eyes for me, and please tell me if you feel something that is soft or if you feel something that is sharp, okay?
Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. Soft. Sharp.
Okay, thank you, Lucy. And apart from one error, they do appear to, your trigeminal nerve
I recognize the error.
appear to be intact. Okay, so now what I'm going to go ahead and do, Lucy, is test your cranial nerve 7, which is your facial nerve, okay? And we won't do the sensory part of this, but we will do the motor part of this. So for the motor part, would you please go ahead and raise your eyebrows for me? Okay, they look to be symmetrical. Now I'd like you to close your eyes for me and don't as tight as you can, and please do not let me open them, okay? Okay, good muscle strength there. Now I'd like you to go ahead and puff your cheeks up for me. Wonderful. Smile with your teeth. Okay, great. And that's great. So now what we're gonna have you do is I'm gonna go ahead and test your vagus nerve and also your cranial nerve. Well, it's definitely a vagus nerve and also your cranial nerve 9 maybe, but I'll check that later. All right, so now we'll go ahead and have you go ahead and open up your mouth for me, please. All right, and would you say ah? And would you stick out your tongue for me, please, and say ah? Okay, looks like it is medial and not diverging to one side versus the other. And can you also go ahead and say yellow Lori for me?
Yellow Lordy.
Lori.
Lori.
Okay. And now go ahead and open up your mouth again. I'm going to see if any fasciculations of your tongue. No. And can you go ahead and stick your tongue out for me, please? And can you move it from one side to the other? Okay, excellent. Now what I'm going to go ahead and do is assess your sternocleidomastoid nerve and muscle. Well, your cranial nerve 11. Your spinal accessory, that's what it is. And go ahead and have you, can you raise your shoulder up on, yep, there we go. And then would you please go ahead and not let me push your head in this direction, or turn your head this way, and then go ahead and do not let me turn your head back. Okay, good muscle definition, great. Come back the other way, please, turn this way. All right, and now don't let me turn your head this way. Okay, excellent. And actually what I was testing earlier, which is sticking out tongue, was the hypoglossal nerve, which is cranial nerve 12. Okay, now what we're gonna do is go ahead and test your different, your muscle strength of different muscles. So we're gonna start by having you go ahead and put your arms up like this for me, please. All right, and do not let me push them down. Okay, wonderful. And now what I'd like you to do is have them more on your side, and do not let me pull it up. Okay, so this is assessing abduction. Do not let me pull it up, please, of her shoulder, and the other one was assessing abduction. Yes, adduction. This is adduction. The last one was abduction. Okay, now what I'm going to go ahead and do is test your shoulder flexion. So this way, have your arm out like this, please, and do not let me push it back. All right, now push it, put it behind you, please, and do not let me push it forward. Okay, let's go ahead and do your other side, please, and go ahead and put it forward a little bit more, and don't let me push it back. Okay, nice. Come back the other way, please, and don't let me push it forward. Okay, wonderful. So that's testing flexion and extension of her shoulder. And now I'd like you to have your arm more over here, shoulder like this. And what I'm trying to do now, you can have it bent a little bit. Do not let me pull it out. So hold it up a little bit.
That way?
So yeah, I'm going to be pushing this way,
Okay.
and you don't let me do that, okay? Wonderful job. Okay. And now go ahead and pull it out here, and don't let me push it in. Okay, nice job. Come around this side, please. We're going to do the same, have it like this, and don't let me pull it out, please. Okay, and then this way, and don't let me push it in. Okay, and then we're testing internal and external rotation of the shoulder. Now we're going to do flexion and extension of the elbows. So start like this, please, and don't let me push your, don't let me pull it out, please. Okay, and now I'm going to push on it, don't let me push it in. Ooh, okay, you want to get a good balance? There we go, okay, great. Now what we're going to be doing is testing the flexion and extension of your wrists. So can we do one hand first and have it go up like this, please? Yep, and you can go ahead and relax this if you'd like. And do not let me pull it, please. Okay, let's do the other side. There we go. Okay, and so that was testing the flexion of the wrist. And now we're going to be testing the extension. So go ahead and have it here And don't let me pull it open, please. Oh, actually, this is, once again, I think I'm doing opposite, but, all right, there you go. Please don't let me pull it open. Yeah, that was testing flexion, and this was extension. All right, now I'm gonna go ahead and we're gonna test the abduction of your fingers. So please pull the adduction of your fingers. Have them open for me, and please don't let me push them together, okay? Harder, go harder, okay? Once again, don't let me put them together. Okay. Okay, don't let me put them together, Lucy. Hard, yeah, resist, there we go. Okay, now again. Wow, that's quite a hard one. All right, let's try again and see if you can kind of resist as I incrementally increase. Okay, that's a hard one. Let's try this one again, or for the first time. Okay, nice job, Lucy. All right, now what we're gonna be doing is we're gonna go ahead and have you put your thumb to your pinky, please, like more like this, yeah, at the base. And don't let me pull it apart, please. Okay, 5 out of 5 muscle strength on those, excellent. And now we're gonna go ahead and test, well, for this one it's actually better if you're on the ground. Do you mind getting on the ground here, Lucy? We're gonna be testing your hips here.
Well, I'll go right here for the camera.
Okay. So for this one, Lucy, we're gonna be testing the, we're gonna start by doing the, this is your flexion of the hip, okay? So for this one, what I'm gonna do is I'm gonna be, I'll have it more like, well, not like this is better. Go ahead and do not let me pull your leg down, okay?
Okay.
Ah, nice job, okay. Let's try this one now. All right, and once again, don't let me push your leg down. Okay, and now we're gonna be doing the same thing, but this time don't let me push your leg up. Okay, but you still want it to have it like this. Don't let me push your wrist towards your chest. Okay, let's do this one. And don't let me do it, okay? Nice job, Lucy. All right, now we're gonna be testing the abduction and adduction of your hips. So go ahead, this time what we're gonna be doing is, we'll do it a slightly simpler way. Go ahead and just have your legs like this, and don't let me push them into to touch each other, okay? Nice, so that's testing Lucy's abduction, and now we're gonna be testing your adduction. Okay, so go ahead and don't let me push your knees to the side, okay? Okay, nice job. And now we're gonna be doing the same with your knees here, okay? So we're gonna be testing your flexion and extension of these. So go ahead and have your knees, the best way is probably to have it like this. Don't go ahead, don't let me, we're gonna be testing first your extension. Don't let me pull, or actually we're gonna test your flexion first. Don't let me pull this open, okay? Or pull it up rather. Okay, ready? Okay, good. Let's do this side. And don't let me pull it up, please. Okay, and then the opposite, you're gonna have it up at that angle again, but don't let me push them close down, okay? There we go. There we go, all right. Nice job, Lucy. Now, what we can go ahead and do is we're gonna assess the dorsiflexion and plantar flexion of your feet. So go ahead and act as though you are pressing on the pedal of a car, and don't let me push up, okay? Okay, ready to go to the side? I was assessing Lucy's plantar flexion. Now we're going to do dorsiflexion. Don't let me, don't let me push down on your foot, okay? But have them start up like this, okay? Don't let me push it down. Wonderful. Okay, excellent job. Okay, Lucy, I can have you back up on this chair. So now we're going to be testing your reflexes, okay? So we're gonna, we'll start with your reflexes. We're gonna start with your biceps, okay? And for this, it's better if you're really loose. So if you can do that, but I'll help out with that too. So go ahead and just loosen up your arm here. Kind of let it hang, if you can. Okay, so Lucy's reflexes are not, I would not call these 2+. These are, that one was honestly pretty much 0. Okay. Alright, so Lucy's not very reactive, but not a terrible finding, to be honest. Now we're going to go ahead and test your tricep reflexes, okay? So once again, have your arm just quite loose here. Alright, that's about it. I would say a 1+. Alright, go ahead and let it be loose here. Okay. And now we're going to go ahead and test your brachial radial reflex. So go ahead and just hold your arm out for me, please. Once again, you do want to have it quite loose. Oh, that was a little one. Okay, that's 2+. Loosen up that arm. Okay, not eliciting a big response here. Let's see if we can try and get it. Let's just loosen up. Alright. We'll go ahead and now assess your patellar reflexes. So yeah, go ahead and have your legs dangled here, please. Try to find patella. And Lucy has already told me that she's not very reflexive, but we'll try again. Okay, try this other side. Slight thing. Maybe a 1+. All right, now we're gonna go ahead and assess your Achilles, reflex here. So for this one, it's probably better. And don't worry about giving me your full weight. Go ahead and just give me your full leg weight, okay? Okay, not much there. Let's try this side. Okay, not too much there. Now we're going to go ahead and test your Babinski reflex. So for that one, go ahead and see if you can just keep your foot here for me. I'd say slight flexion with that one. Okay. Oh, there was a little one. Okay. She did have it was rather a negative Babinski. Okay, so now what I'm going to go ahead and do, Lucy, is assess some different, your rapid motor reflex, okay? So for this one, what I'm going to have you do is copy some movements I'm having you do, okay? So one of them is if you can go ahead and we'll just do one hand at a time and flip it back and forth as fast as you can here on your thigh, as best you can while doing this back and forth motion, okay?
Okay. Starting now.
Yeah, whenever you're ready. Okay, excellent. And now we're gonna have you do the other side. Okay. And now what I'd like you to do, once again, just one hand at a time, is see how fast you can touch your finger to your thumb, okay?
Okay.
Okay, excellent. Try the other side now. Okay, wonderful. All right, now what I'm gonna have you do is you're gonna start by touching your nose, and then you're gonna touch your finger to my finger, okay? And I'm gonna move it around and do it as fast as you can while still making contact with my finger.
Okay.
Okay. Okay, excellent. And now what we're gonna have you do is I'm gonna go ahead and assess your gait here. So go ahead and stand up for me. And go ahead and walk from me to that couch over there, just walking as you normally would. Okay, good, even gait, and stop when you get there. Thank you. Turn around and come back towards me. Okay. And now, this time going forwards, can you do it while standing on your tippy toes, please? Okay, good. And come back to me on your tippy toes. Okay, good balance. Now go ahead and turn around and go back. And I'd like to see you do it on your heels, please. Okay, good bilateral movements. Come back this way as well on your heels. Okay, your shoulders are staying pretty even throughout. That's good. Now I'm going to go ahead and have you, if you can, walk heel to toe for me all the way to the couch. Okay, this requires balance and also proprioception. Wonderful. Okay, now you can go ahead and come back towards me the same way. Okay, excellent job. Now what I'm going to have you do is we're going to do something called the Romberg test. So for this one, go ahead and just put your 2 feet together for me, please. Stand up straight, and then just close your eyes and stay standing as straight and as still as you can. We're going to assess her for 30 to 60 seconds. We'll just do 30. And what I'm looking for at this is to see if Lucy has any fasciculations, if she's able to stay still without any tremor. And slight tremor is a normal finding, but that she's able to keep her balance. And it's testing as well her vestibular area of her brain. Wonderful, Lucy. Okay, that is great. Now what we're going to do is do the protonator test. So for this one, go ahead and put both hands out in front of you as if somebody's giving you a box of pizza. And once again, I'm going to have you just close your eyes. And for this one, we'll do 20 seconds. And this shows as well muscle strength, but also proprioception. And we can make it a little bit harder by pressing down slightly on Lucy's arms.
Should I come back up?
Yeah, you don't need to, don't play into it. Just like let me push down. You can resist a little bit.
Okay.
Let's see if you're able to bring it back up to the same spot. Okay, excellent. Good job, Lucy. Now we're gonna have you go ahead and sit down on this chair again, if you don't mind. Realize one element I forgot to have you do earlier to check as well for your proprioception is, can you go ahead and take one heel of your foot and run it down from knee to the top of your foot, the other foot. Okay, and can you do the other side, please? Excellent. Okay. Now what we're going to do is we are going to assess what you can feel without having any visual cues for it. Okay, so go ahead and if you don't mind, hold out each of your hands for me. And I'm going to put something in one of your hands. Okay, close it around there, and please tell me what that object is without opening your eyes.
A coin.
Okay. If you had to guess what size coin?
Oh boy, a nickel.
Okay, thank you. Bring it back to me. Alright. Now tell me what is in that hand.
A marble.
Okay, is it bigger or smaller than the object you had before?
Like the same size.
Okay, thank you. I'll take these back. And for reference, Lucy, if you want to see, these are the two objects.
Yeah.
Okay, but you
How would
agree-
I know what coin that is? It's not US.
Okay, well. Alright, now what we're going to do is we're going to go ahead and test your ability to feel soft things all over your body. Okay?
Okay.
So, for this one, yeah, go ahead and close your eyes and go ahead and we're going to just do the extremities and you'll tell me when you feel something touching you, okay?
Okay. Now. 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 Now, 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 now. Now.
Okay, excellent. Then we're going to go ahead and test your ability to feel a sharp, yeah, we're going to see if you can feel a sharp object on your body, okay?
Okay.
So close your eyes and once again I'll be using something reusable.
Now. Now. Now, now. Now, now, now. Now. Now, now, now. Now, now. 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 Now.
Okay, excellent. And now what we're going to do is, oh actually I would use the tuning fork again and see if Lucy can feel vibrations on her hands and on her feet. So I would do this and I would touch it to different parts and see if she can feel the vibrations. But as it's a fake fork, that doesn't work. Okay, so now what we're going to do is I'm going to have you see, I'm going to touch you with another object and I would like you to tell me whether it is 2 points or 1 point. Okay?
Okay.
And close your eyes for this part as well.
1. 1. 1. 2. 2. 2. 1. 1. 2. 2. 2. 2. 2. I don't know. 2. 1. 1. 1. 1. 2.
Do you mind holding your hands out for me, please, Lucy? Oh, thanks. Close your eyes again.
2. 1. 2.
Okay, thanks. So you're quite sensitive on your hands and then on other parts of your body, not so much, but that's actually quite typical. Something else we're going to do is go ahead and close your eyes for me one more time and hold out your hands for me so you're doing a stop sign. Thank you. And then I'm gonna draw something on here and you're gonna tell me what it is, okay?
Okay. The letter B. A curly Q. S, maybe. O.
Okay, thank you, Lucy. All right, so it looks like your motor strength is, or your muscles I found were all 5+ bilaterally that I tested. I found that your cranial nerves, all that I tested, were intact. And that also that any other sensory neurons peripherally were intact as well. Now's the time I'm gonna get to look at my sheet and see if there's something I forgot. So you can keep recording. Let's see here. Actually, I did everything. Okay. Well, thank you. Thank you, Lucy, for being my patient today.
Mm-hmm.
Okay, all done.